next session, I'd like to call the next chairperson. The next chairperson is Dr. Vinod Jain, sir. I welcome you, sir. He is an MBBS and MD from SMS Jaipur. And he is a senior professor in the Department of Skin and Beauty in SNMC Jodhpur. Kindly chair the session, sir. And I'd also like to welcome Dr. Mukul Sharma, sir, to chair the session. Sir is a senior professor in the Department of Dermatology in the Government Medical College, Kota. He has more than 80 research papers in national and international journals and has delivered various guest lectures and a guest lecture in European Congress of Dermatology at London. His special interest is STD and has delivered more than 200 health educational talks on STD and AIDS. And he has been a past assistant editor of IJSTD and a co-editor of JCES. We welcome you, sir.
If Dr. Kailash Mehrania is on online, can please join, because I am unable to see his name in the list also. And I am very happy to announce that abhi kitne registrations ho gaye? How many people are viewing this conference? There are more than 400 people they are watching throughout the country. So it's a big achievement for us, and thank you very much. Please go ahead.
Thank you so much, Dr. Dinesh Mathur sir, and the whole team CODFICON for this opportunity. Well, I'm giving a mammoth task of elaborating a new entity in our dermatology, not only dermatology, but the whole earth, that is mass dermatitis. And I have added a spice in that, unmasking Monalisa smile. Just because of the fact that in 16th century, when Leonardo da Vinci made this painting, he haven't had thought of this very thing, that there would be a mask and a sanitizer and gloves in the hands of Mona Lisa in 21st century because of certain things. And that is why we are using so many different masks in our day-to-day practices. I'll not go in elaboration of that, but even all governments have to make mandatory the use of mask. For us, it's one of the most important part. For some, it's a fashion statement. For some, it's a gutka spitting thing. And for some, it is to become a Santa Claus on their mask face. But we have to understand that even Judiciary of India has to make it mandatory to wear the mask. And there are variable degree of protection with the mask. And because of this overburden thing, the whole of earth has to take this burden, and it will take generations. Not only that, on the face of earth, but on our faces, it is becoming one of the major problem which can cause the thing. So this mass dermatitis is becoming a new entity because of prolonged wearing, protective respirators, the medical and the fabric mask which we are using, the excessive sweating, the moisture and the friction which has been there. The closed and warm environment in Indian setup is actually making it more problematic. There could be multiple of the chemical irritants which can cause sensitivity, and therefore it can even lead to irritant or the allergic contact dermatitis. The medical masks are better of the mask, but the fabric masks which can cause a lot of problem because of removal of this by certain chemicals, the perfumes. And yesterday I was talking with Dr. Kaushal Verma Sahab that there could be even dyes with fabric mask which can cause the problem. The pathophysiological changes, though not much of the articles have been made, but it can lead to impairment of the carotenoid function, the release of pro-inflammatory cytokines, the change of microbial flora. Those normal flora has actually been changed into different thing, and then there is change in the pH and transepidermal water loss on the skin surface. In addition, because of the pressure of the mask, it can cause pressure injury, urticaria, skin dryness, itch, and aggravation. In clinical features, as females lead every part of our things, so here also, the females are the major bird taking care of the things. It is between 20 to 60 years of age. They might be using the mask more common or fabric mask more commonly. The most common symptoms encountered was dryness and tightness, while the most common sign was desquamation. There can be red bumpy rash around the mouth and chin, and local impression redness erosions. And the area around the eyes even could be involved in this very case. The dermatitis could be of many types. We can see a generalized kind of dermatitis around all over the face. Then there could be around the perioral area, then perinasal area. We can see the red bumpy marks, then the submental area. What we can see here, that there is a sparing of certain areas which are not been contracted with the mask. The areas which are not touching. Then it can be on the malar areas. The pronounced erythema can be very important diagnostic sign in the same. The metal clips on the nose itself, that can cause the pressure injury, or even the chromium or nickel present in the metal when used for prolonged time can cause. So these are the important things which we can see. Even pigmentation can be pronounced in these cases. The loop mask, which causes the retroauricular dermatitis, we can see it's a very, very problematic phase where people are not being able to use the mask for prolonged time, and this can lead to a severe contact allergic or irritant dermatitis. The potential causative allergens, I'll not go in detail, but there could be many, including dibromodiazepine, formaldehyde, thioureum, and multiple other guanidine diestate compounds which are used in the formation of the mask. There can be polyurethanes, triglycerides, then bronophols, and in addition, very importantly, the masks which are not labeled can have multiple potential allergens, including dyes, which can cause the problem. Diffuse of disinfectant. Many times patients, what we or patients are doing, that they are putting sanitizers inside the mask to sanitize them. But what it can lead to, one of my patients had severe contact irritant dermatitis, which was solved by taking out the thing. Then the synthetic fibers are issue to some people, and likewise the laundering and detergents in the mask can be the problem. The differentials can be many, but the most important could be the acneiform eruptions, rosacea, acute cutaneous DLE, the seborrheic dermatitis, and sarcoidosis. We can see in this young man that it is not actually due to the mask, due to acne itself, but there is sterile pustule around the mouth area. Then aggravation of the mask acne. I have not included mask acne in this, but mask acne could be a big problem in these cases. Aggravation of facial tinea fasciae itself. There's a strap on the behind the neck area can cause the problem on this very part. Then the aggravation of LPP-like pigmentation could be there in many patients. Then there could be more of contact dermatitis around the lip area, or perioral dermatitis could be there. And very importantly, this could be a very important part that one of the patient reported formation of chemical leukoderma in this very case. So this can be a part of study in future of aspects of our mask usage. Dermoscopy reveals not specific of the things, but the same changes which allergic dermatitis shows. Patch test could be of help in our cases. The preventive measures, the most important preventive measure is to use a standardized mask, a properly fitted mask, and only certified mask. We have to stay in cool environment because the sweating can induce it. The hydrocolloid jelly or the topical zinc oxide can be reduced to prevent the friction over the, and we have to reduce the already existing facial dermatitis. The therapeutic strategies could be to use a different mask than the sensitivity which is there from that particular mask, using certain things such as boric acid or saline to clean the area, and topical antibiotic cream can be used. Other than that, antihistamines or steroids can be used in tapering dose. For practical tips I have involved in this very part is not to use the loop mask, but to use the masks which are not touching the skin directly. Then we have to mark the mask whenever we are using, so that we should know that how many times we have used the mask. We can just mark it with the pen itself. Then we can use a simple tissue paper strip on the nose itself or the areas when we can change those strips regularly in 2-3 days. Then sanitizing the mask, rather than sanitizing the mask with some sanitizers, we can use simple sunlight or simple UV radiations. In a study done almost in 2015, it was shown that we touch our face for 15 to 20 times before COVID. And can you imagine how many times we are touching our face or hair in this COVID era? It is almost more than 100 times. This T-zone of the face, we are touching almost 100 times in an hour. So we have to make it sure that we have to say to the patient that you have to avoid touching your face, the T-zone itself. We can use face shields in these cases. The mask, how long we have to use, this is a very important question. At a particular time, the American government had said that we can raise a bar against using the mask, but now it has reversed the thing and we have to mandatorily use the mask itself. I started with Leonardo da Vinci and completing my talk with another picture by Michelangelo. At one time, the hand of God gave the life to the human being. And now, the mere touch, not touch, but the sanitizer is giving the life. Many times patients are asking, how long, doctor, we have to use this COVID behavior? I said, I have received a message from the Chinese president, Michami Dukadam, that sorry for the same, because he has done all the things unknowingly, but what we say to him, there is an answer to that, that we have changed our behavior, but the attitude of living is same with all of people on the earth. Thank you so much.
Thank you, sir, for your talk.